Welcome back. Let's talk about the complications of anal sex in pregnancy. If you decide to have anal sex during pregnancy, it is important to understand the safety concerns. For starters, anal stimulation can irritate hemorrhoids, also called piles. This itchy, painful varicose vein often appear in the anus and rectum during pregnancy, and of course, they become even more uncomfortable when irritated. Aggravated hemorrhoids may also cause rectal bleeding, which is not dangerous unless the bleeding is severe. And there are also other concerns such as anal fissures, bacterial infection, and sexually transmitted infection (STIs). You will always you will also want to be especially careful if you have certain high risk pregnancy conditions. Here is what you need to know when you want to involve in anal sex during pregnancy. Anal sex can resist tears. They can form in the anus from a constipation, a common pregnancy complaint, and they are prone to ripping and bleeding. Torn anal fissure harms the fetus, but they can be painful for the pregnant person. Hemorrhoid and anal fissure are very common during pregnancy, occurring in as many as 40% of pregnancies. Then we have bacterial infection. In some cases, anal sex can lead to bacterial infection in pregnant women. Infections are especially likely if you switch from anal stimulation to vaginal stimulation, especially without changing condoms or washing off the penis, finger, or the toy that was used in or around the anus. Infections that might result from anal sex include bacterial vaginosis, why very common and rarely a cause of concern outside of an unpleasant fishy odor and discomfort. Bacterial vaginosis has been associated with miscarriage and preterm labor in some studies. Number two, urinary tract infection, UTI. If left untreated, UTI may cause a kidney infection that puts a pregnant woman at risk of preterm labor or a low birth weight baby. Number three is giardiasis, which is caused by the parasite Giardia lamblia. Giardiasis is linked to malnutrition, dehydration, and weight loss, which negatively affect the health of you and your pregnancy. Then we have sexually transmitted infections. In addition to bacterial infection, anal sex during pregnancies increases the risk of sexually transmitted infections, STIs. Some STIs can be transferred to the baby during delivery and rarely through the placenta, potentially leading to long-term health consequences. For example, gonorrhea has been associated with premature birth and stillbirth also. The herpes virus can also lead to neonatal herpes and neurological problems for the child. And of course, hepatitis B can damage the liver. Then when we're talking about high-risk pregnancy, pregnant people should avoid anal sex altogether if they have certain high-risk pregnancy conditions. You understand? And when you're talking about this high risk, one of them is placenta previa, where the placenta covers some of all parts of the cervix, the opening of the cervix, premature rupture of membrane, and of course, it can lead to preterm labor. So you want to have anal sex during pregnancy, see your healthcare provider to seek proper advice. See you in the next video.